injections that we're offering now, and when the body has an injury, platelets that are made in the bone marrow go to the site of the injury. And you can either have a platelet-rich plasma injection where we take blood from the patient and inject it at the site of the injury or the site of the arthritis to try to stimulate regeneration and healing, or we can go one step farther and take the patient's actual stem cells, which are derived from bone marrow or from fatty tissue. And those are injected at the site of the arthritis to try to stimulate regenerative processes as well. Platelet-rich plasma injection is where we draw blood from the patient just like you would at your normal doctor's office when you give blood or have your labs drawn. Stem cell takes it another step farther. That's an actual aspiration of the bone marrow or fatty tissue from a patient, which goes through a process, and we subtract and dilute it and remove the stem cells from that tissue. So the good thing about it is they both come from the patient. They're both the patient's blood. One is just the blood from the vein and the other is from the actual bone marrow or fat tissue. That's the really good thing about these treatments is they can benefit all age groups. Patients with tendinitis, younger patients that have athletic injuries, partial rotator cuff tears, dislocated shoulders, tendinitis around their joints, they can benefit from the platelet-rich plasma injections. And then the stem cells are more for arthritic conditions. So they're going to benefit those elderly patients that have arthritis, say of their knee, but they're not medically fit to undergo surgery for a replacement, or middle-aged to younger patients who have terrible arthritis of their knee and just aren't quite ready to go through that surgery yet. Yes, that's the good thing about these treatment options is they're appropriate for all age ranges. For instance, the platelet-rich plasma we've done on a high school athlete, baseball player that had a dislocated shoulder with a partial rotator cuff tear, and with the platelet-rich plasma, he was able to return to practice much quicker than without that technology. And then on the other extreme, we've injected stem cell injections in a 90-year-old patient with terrible arthritic knees, but her doctor wouldn't clear her to undergo the risk of a knee replacement. So this was a good technology for her because she was able to get relief without the risk of surgery. Well, the good thing about it is the process is done entirely in our office with no anesthesia, because it's basically just a blood draw like you would do in your regular doctor's office when you had your cholesterol or blood count checked. We draw some blood and we put it in a machine that centrifuges it. It allows us to distill the plasma, which has all of the growth factors. So when we inject that into the area, which is done at the same setting, say we're treating the shoulder, once we inject that into the shoulder, all of those growth factors get to go right into that area and start work immediately. No, the injection is done one time in the office, and then we arrange for a follow-up visit to see how the injection is doing and how the patients are proceeding. That's the tough part with these new technologies, is we don't really have a lot of literature studies that can answer that with a specific date or time range because it's so variable in different patients. But in my experience from doing these, we've seen patients who have got benefit within a week from the PRP injections, within 2 weeks, and then with the stem cell injections, we've seen patients who within 2 weeks had no pain at all from their terrible arthritic knees. And it has lasted for up to several months now. Actually, no, there's no physical therapy prescription involved with this process like there is after surgery, because we want the area to have all of the growth factors locally there to provide that regenerative healing process. So we actually want that joint or that tendon to rest. And there's not any absolute restrictions on patients. I encourage them to continue their normal daily activities, but I don't encourage them to do rigorous or strenuous activities or exercise above what they normally do until they come back and see us. You know, we get that question a lot because patients are used to having cortisone or Synvisc or some kind of hyaluronic acid injection, and they get that on a pretty much regular basis every 3 to 6 months. But with these procedures, you don't have to repeat them that often because they're so successful. Now, could you repeat them? Yes, because they come from your body, they're your tissue with no disadvantages. So you could repeat them as needed with no particular time between the injections. But we see such a beneficial response that I haven't had to do any repeat procedures on any patients yet. Basically, I can sum it up in one word, and it's wow. The response from the patients has been incredibly positive. I've seen no adverse reactions, and I've seen no disadvantages to the product at all, because unlike some of the products we had in the past, with cortisone having all of those disadvantages and bad side effects, this comes from the patient's body, so it's natural to them, it's known to them, so there are very few side effects at all from this other than some local irritation from the injection or from the harvest site, but the reaction and the benefits have been tremendous.